Good afternoon, everyone. Thank you for taking the time to be with us today. My name is Sean, and I'll be your host this afternoon. I'm joined by a panel of healthcare professionals and colleagues who will be sharing their insights and experiences from Kaelo's perspective. As organizations continue to evolve, so do the needs of their employees. We know that thriving businesses are built on healthy, engaged, and supported people. Yet in today's fast-paced and demanding environment, employees are facing unprecedented pressures, personally and professionally. Today, we'll be exploring the relevance of an employee assistance program or an EAP in the modern workplace, why it matters now more than ever, and how it can make a meaningful impact on both employee well-being and business outcomes. If you have any questions, please pop them into the chat below, and we can answer them at the end of the session. So let's dive right into our first question. Celeste, tell us what mental health looks like in today's world.
Thanks, Sean. I think when we think about mental health and we think about those times that we really struggle, we think that we're alone. But the data tells a different story. The reality is that mental health challenges doesn't wait for the right time. And it actually doesn't care what's our gender, what's our income status, what's our race, or our titles, right? When we struggle, we struggle. We know that globally, 1 in 8 individuals will be diagnosed with a mental health disorder in their lifetime, most commonly anxiety or depression. We also know that South Africa is one of the most stressed countries in the world. I know we've had this conversation internally. Middle of the year, everyone is stressed. Closer to home, it is estimated that 1 in 3 South Africans will struggle with a mental health condition. And I guess more concerning is that we know that only 1 in about 10 will get the help that they need. I think when we talk about mental health, it's often a reality that we think of it as something out there instead of something really close to each and every one of us. We have to remember that mental health is not the absence of a mental illness or a mental disorder, but it's in how we think and feel and just go about life every single day. It's how we handle stress and build effective relationships and enjoy life, even when things get tough. Positive mental health, and I think we've all read and heard about the impact that has. But when we have positive mental health, we're able to realize our full potential, cope with the stresses of life, work productively, make meaningful contributions to our communities and our families, etc. But when our mental health struggles, we often feel overwhelmed, alone, and unable to cope in healthy ways. This is often where people turn towards unhealthy coping mechanisms. We start seeing that people cope by perhaps drinking too much or withdrawing from loved ones. You know, those mindless days that you lie on the couch and just scroll through TikTok or binge watch Netflix, where you really just withdraw. Anything to numb the pain and escape for a while. If these feelings often go on unchecked, it could lead to feelings of hopelessness and despair, and ultimately could lead to something like suicidal thoughts. We know in South Africa that it's estimated that there's about 23 successful suicides a day. I mean, that's nearly 1 every hour. And it's estimated that about 230 more attempts happen. Often that's underreported because not all attempts are necessarily reported. So it's staggering and concerning. But I know that Jordan also has a couple of interesting thoughts and ideas around this that he's seen in his world. So George, if you would like to add.
Yeah, thanks, Celeste. Staggering numbers indeed on the suicide counts. But before I speak a little bit more about suicide, I want to point out that poor mental health is having impacts that reverberate across the entirety of the private healthcare and private health insurance markets. A study last year of medical aids in South Africa found that the biggest driver of hospitalization costs in South Africa was depression. This is the number one cause by rand value, higher than long-term ventilation and ICU, higher than the cost associated with C-section delivery and heart surgery, at nearly 4% of all private hospital costs. Admissions for mental health struggles are frequent, they're lengthy, and they're very costly. The trend is worsening to the point where new hospitals are being built to handle the demand coming in due to mental illnesses. Netcare acquired Akeso Clinics a few years ago, and since the acquisition, they've continued to roll out the footprint even more broadly across the country. So now there are multiple facilities, I think something like 16 in 6 different provinces. There's one being built in Limpopo as we speak with over 100 beds. Another facility has recently been built in the Eastern Cape, the first facility in the Eastern Cape. And quite a marked example of this trend is that a maternity ward in Belito was shut down a few years ago, despite the prevalence of C-section deliveries in the private hospital space in South Africa. And it was replaced with additional beds to deliver mental health care services. So this isn't just anecdotal. This is real. This is in the data, and it's affecting healthcare costs. It's affecting allocation of resources in the private sector, and most probably in the public sector too. And we see a similar concerning trend in life insurance claims as well. So the most common cause of non-natural death in South Africa's insured population today is now suicide. It's no longer motor vehicle accidents. It's not violent crime. It's people taking their own lives. And there's been a massive increase in suicide rates over the past 5 years, particularly in older age groups. I think generally we associate mental health difficulties with younger generations, but the suicide data tells us that difficulties are being faced at all ages. In older age groups, I think the increase has been over 60% versus the suicide rate five years ago. But suicides are really just the tip of the iceberg. When looking at the impact that mental health has on mortality risk, the risk of dying, the real risk relates to how mental illness affects otherwise preventable physical health conditions that worsen over time because of a mental illness. For instance, someone with a mental illness is 3 times more likely to die from a cardiovascular or respiratory or metabolic disease than someone who does not have a mental illness. Some studies actually say it's 6 times, 7 times higher. So it really depends which studies you're reading. If you're diagnosed with cancer, you're twice as likely to pass away from that cancer than someone who does not have a mental illness. So suicides only account for less than a quarter of early deaths due to a mental illness. The preventable physical health piece accounts for the rest. And the result is in South Africa that life expectancy is 10 to 20 years shorter for those with a diagnosed mental illness than the general population. And it's not just death, it's also disability. Disability claims to insurance companies are on the rise, and incapacity due to mental health related condition is now the 3rd biggest cause of disability after cancer and musculoskeletal conditions. And this is now accounting for nearly 1 in 5 disability claims. So yes, Celeste, to add to what you're saying, suicides are on the rise. It's a concerning trend, but the broader trend we are seeing is more concerning than the suicide trend in isolation.
Oh, thanks, Celeste and Jordan, for sharing that information. I mean, some of those stats, Jordan, are quite alarming. It brings home how urgent and far-reaching the issue really is. So, I mean, let's explore it from a business perspective. Danny, why should mental health be a concern for businesses and leaders today?
Well, Sean, I think mental health is in fact a critical concern, or should be a critical concern for both business leaders and employers, because poor mental health directly affects things like productivity, safety. The overall success of an organization is also impacted by it. When employees struggle with their mental well-being, it manifests in ways that hit both the financial and moral code of a business. One of the major impacts we're seeing is absenteeism. So in South Africa, absenteeism due to mental health costs the economy between 12 and 19 billion rand annually, with around 15% of employees off work at any given time. Absenteeism disrupts things like workflow, it increases the costs of HR, overtime, temporary staff, and can severely affect team morale. Equally concerning, I'd say, is presenteeism, where employees show up at work, but they perform below their capacity due to untreated mental issues like stress, anxiety, or depression. The hidden cost of this is estimated to drain about 89 billion rand from South African businesses, which is equivalent to around 5% of gross profit in business. Presenteeism is particularly deceptive because it goes unnoticed, but causes significant productivity losses. We're also seeing a growing phenomenon of quiet quitting, where disengaged employees do the bare minimum, so they withdraw their efforts, they withdraw commitment, can be linked to things like burnout, mental fatigue, further eroding businesses' outcomes and company culture as well, actually. Beyond financial loss, poor mental health in the workplace harms morale, it increases burnout, drives higher staff turnover, and results in loss of valuable skills and knowledge. I know my colleague Mo has got some examples for us. He's one of the specialized consultants within AskNelson. Mo, I know you've got an example there.
Thank you, Daniela. Considering what you've shared, I can think of when a personal breakup nearly cost the company more of its business, adding to its liability. And not because of poor management or bad strategy, but just because of the fact that no one saw it coming. In an example I wanted to share, I can think of a time when one of our clients formally referred an employee to us, and this is after the employee was involved in an accident whilst on duty. The said employee works as a bike delivery driver whose responsibility it is to deliver prescription medication to clients, which, as you can imagine, is a safety critical role. So in this incident, client medication was compromised, as well as damage being done to another motorist's car. Apologies for that. So during sessions with this employee, he had disclosed that he'd been going through significant relationship issues, which were affecting his concentration, his mood, and his ability to manage his stress. So whilst on the surface, the incident prompted the referral was work-related, the root cause was a deeply personal crisis. What looked like a performance issue was actually a personal breakdown bleeding into the workspace. If he hadn't received the necessary support in which he did, this employee could have continued their day whilst being mentally checked out, leading to the presenteeism that we've just spoken about. The risk here, not just to himself, but to also the company's liability, reputation, and most of all, other human lives. This case that I'm bringing forward now just illustrates how a seemingly personal issue like a relationship stress can escalate into a workplace accident, especially when we consider how high risk the role in this case is. For the business owner, the real concern isn't just the accident, but what led to it. And without appropriate support, much like what AskNelson delivers, This driver could have continued working under this stress, putting himself, the company, and others at risk. And that's why having a confidential, accessible support channel like AskNelson isn't just an HR perk anymore. It's a critical business tool.
Very true, Mo. I think what we're taking from what you're saying is addressing mental health is not just an HR concern any longer, but rather a strategic business imperative. Offering accessible, confidential support like an EAP can make all the difference.
Yeah.
Having the support helps identify and address underlying issues before they escalate into these accidents, mistakes, or costly downtime for a business. So it's clear that personal issues can quickly become workplace risks if not managed proactively. Lorato, you are on the front lines at AskNelson. Can you tell us some of the common challenges that you're seeing from employees today?
Thank you, Sean. As you can imagine, we see quite a plethora of types of cases and examples. And one of the two cases that I can think of from the top of my head, there's a case of a single mother who had been applying for a promotion within her company for 3 years. The motivation for the promotion was due to financial challenges and being the sole provider for her son, and for growth purposes, as everybody wants to grow. When she didn't receive the promotion after her third attempt, she was so upset after receiving the news that she got into an altercation with a customer. As a result, the client has been suspended from work pending a disciplinary process, and you can imagine the impact this has had with the customer concerned. I think for most of us, we just think, it's just a promotion, but it's not just a promotion. Yes, it's a financial boost for this young mother, but for her in the session, she spoke about how this was a dream for her to break the cycle of poverty and the background that she was coming from, a possibility for her to show her son a different future. The one thing, Sean, that stuck me over and over, that she mentioned over and over in the session, is she kept mentioning how she wanted to make her son proud and how she felt like she had failed him. Career growth is a big driver of performance and productivity in employees. As leadership or management, a big part of our role is to ensure that growth and development of our staff. This can be done through open communication that fosters transparency and psychological safety. If this employee had received sufficient feedback on the reasons why she had not been receiving this promotion for 3 attempts, she may have been successful in her last attempt. She may have been motivated to reach out to the AskNelson team for career guidance and coaching to enable her to work on those areas of growth that her manager had identified, and then subsequently reach her career goals. Another client, as I'm thinking of as well, Sean, is in the process of a divorce and is currently separated from her husband. As a result of the separation, she's had to move back home, and she's now the primary breadwinner of the children, as the husband is not helping with the maintenance of the children. The move back home, while it's meant to be a cost saver, is actually more of an expense because it's further away from where the school of the children are. This means she spends more money on transport for the children, and the children travel further, which causes her to be anxious for their safety, as any mother would be worried about children leaving too early and coming home really quite late. As a result of this and other costs and the burden of being a single parent, she's borrowed so much money from your legal people, such as your mashonisas, that she's unable to pay them back. And she's stuck in this endless cycle of earning back her salary and paying these guys off at month end. It's now gotten to a point where she's afraid for her safety because she can't pay them back. They know where she works, they know where she lives, and she's living in fear. Obviously, this has implications in both her occupational and social functioning. She reported challenges with remembering simple things, productivity, focus, concentration, and so many other issues. All these challenges and adjustment difficulties that are due to a divorce are quite traumatic for both mother and children. Furthermore, this can be equated to something like a loss, because it's the loss of a family structure, the loss of a lifestyle, financial loss, and the loss of a dream for the kind of future she envisaged for her children. In this example, if the employee had had a solution such as AskNelson, the employee may have been directed to use the AskNelson services when the separation began for supportive counseling services for her and her children. As part of that process, she may have been further referred for legal advice pertaining to the divorce and ensuring that she could receive maintenance from the father of the children. Furthermore, she may have been referred to use financial services and received guidance on responsible lending and not had to access services of mashonisas and find herself in this endless cycle.
Yeah, thanks, Loretta. I mean, those stories, they're so powerful, and so relatable. They're not uncommon situations. I mean, it makes you think, are we under more pressure than ever before? And is it just growing year after year? Celeste, I'd like to actually ask you that question. You know, have employees or people just got more pressures than before? Has COVID played a role in that? Has the new world of work, the hybrid environment, changed our challenges and what we're facing from a mental perspective?
100%, Sean. I think the answer there is 100% yes. It was Henry Ford way back when that said he didn't understand why is it that he got the whole person when all he needed was two hands. And I think the reality is, whether we want it or not in our businesses, we get the whole person. And I think to answer your question, it's important to also see how EAPs have evolved over time to accommodate for these ever-changing challenges that human beings keep facing and that they bring into our workplaces. So traditionally, in the 1940s and 50s, EAPs started as what they were called back then occupational alcoholism programs, and it really focused on identifying employees, mainly in the manufacturing and rail work industries, that struggled with a substance abuse issue, and then just to support them from that perspective. By the 1970s, 80s, it expanded from merely alcohol support programs to a more broad-based support element, where companies realized that there's a whole lot more happening than just people maybe drinking too much and not being productive at work. So the term employee assistance program was really founded at that point to accommodate this expanded focus of supporting employees. And it was in this time that companies like IBM, Ford, and General Motors really institutionalized EAPs to tackle things like absenteeism, turnover, and workplace accidents. EAPs then spread internationally around the 1990s and started to be incorporated in places like Africa, Asia, and Latin America. And the focus really shifted from these reactive interventions, so problem-focused, to more proactive well-being elements like prevention, stress management, crisis support. And that's really what we see today. So we know today most EAPs for many companies are outsourced, like our Kaelo lifestyle program, etc. So if we look at the COVID-19 pandemic, it's definitely forced EAPs to evolve as people's challenges evolve though the core human struggles remained the same. We know that COVID almost shone a light on it, a magnifying glass, because suddenly we were all dealing with these unknowns. And it almost became okay to say, I'm not okay. I'm struggling with this new reality that we're facing. So the pandemic really accelerated and intensified trends that exposed gaps that still shape what people face today. It amplified the stress, anxiety, depression, and burnout, and often loneliness, issues that were already there, but stigma and underreporting almost kept them hidden prior to the pandemic. Remote work blurred the boundaries between work and home. I'm sure we all can remember the days where your laptop just remained on the dining room table, and as you walk past it at 7, 9 o'clock at night, everyone just felt the need to be working for those longer hours. Job insecurity and economic economic uncertainty still weigh heavily on many people. I think Lorato's example so clearly highlighted that inflation, rising living costs, and the economic aftershocks that we're still facing today just creates those challenges. Many people today also feel more isolated despite the many digital tools we have to connect. And families and relationships have changed. Some got together during COVID and really built great relationships, but for some it was a very stressful period, and some of those relationships still haven't really recovered. And our EAPs needed to evolve along with these challenges and supporting people to really provide the relevant support needed.
Yeah, thanks, Celeste. I mean, with the EAP that we offer and the offering going into any business, I'm interested to know if we see any trends or any challenges across certain industries or age brackets. Danny, maybe you've got some stats you can share with us on that?
John, so I know our biggest trend across the board is stress. I mean, I've been with Kaelo for the better part of 8 years, and it's been stress for 8 years. Industry specific, I wouldn't be able to say to you if there are trends which are more specific to some industries than others. I think the data on that is very circumstantial. So what I can tell you is that the severity in certain industries is higher than in others. So for example, your frontline workers, generally the cases that come from there are a lot more severe and require a little maybe longer intervention to get to the bottom of. One of the biggest underlying causes of the stress that we're seeing, though, in fact, 68% of all the cases can be traced back to a financial issue. So I'd say finance and stress are the biggest.
Yeah. Actually, I'd like to go into that finance discussion a bit more. I mean, financial stress seems to be a major underlying theme across all areas. So how does this manifest, and what does it actually look like from an employee perspective? And then how do we begin to address it?
Sean, I think taking a step back and recognizing that the reality is that a third of South African credit holders are struggling to keep up with their debt payments is probably a good place to start. Despite the challenges that people are struggling with to keep up their payments, the demand for that debt still grows year on year. I know the latest consumer studies report showed that access to credit today is higher than it's ever been before. In 2007, for example, 16.8 million people had access to a credit card, and 6 million of those people were struggling to repay that back. So that's almost 36%, right? In today's world, that ratio has risen to 40%. So every year, there's a little more people with access to credit who are struggling to pay it back. What's severely concerning is that it's not your lower income groups who are struggling to pay this back. It's increasingly more your middle to higher income consumers that are struggling to repay that debt. And we see that in things like a rise in arrears and default rates, high rejection rates from formal credit applications. There's fewer credit approvals happening at the moment, and a growing reliance on high risk borrowing options. So for many South Africans, financial stress looks like a complex web of daily pressures, far beyond making simple ends meet. Many South Africans hold average jobs where their salaries cover basic needs but leave little room for emergencies or unexpected expenses. Add to that the limited financial literacy that many face, making it harder to budget, save, or borrow wisely. When an unexpected cost comes up, like a medical bill or car repair or school fees, people often feel pushed to go to more informal lending solutions. So in South Africa, it's commonly known as mashonisas. It's formerly known as loan sharks. And while these guys offer quick cash, they come with exorbitant interest rates and sometimes threatening repayment tactics as well. These scenarios trap employees or members or people in South Africa in vicious debt cycles that it's really, really tough to break through from. Beyond the financial burden, many South Africans also face social pressures to maintain lifestyles that they simply can't afford. Keeping up appearances for families, communities, or work adds another layer of emotional stress and anxiety. And this strains not only their finances, their mental health, their focus, and motivation at work as well. I know Celeste has got an example on how financial pressures are shown up within the AskNelson team as well.
Yeah, thanks, Danny. One of our counselors actually shared with me a formal referral that came through, and the referral highlighted that the employee was a bit unfocused at work, and there was a history of regular absenteeism. But they started picking up that by the 10th of the month, this person just wasn't coming to work. So the formal referral was sent to us to try and support. And when the counselors started digging deeper, it was exactly these things that you were explaining now. So there was a lot of debt and he needed to be paying back all these things. So productivity was a bit down because presenteeism was high. He was worried about all these things. But by the 10th of the month, this guy had a R0 bank balance. There was no money in his account. He physically could not get to work. So he spends time working only to get to the 10th of the month where he can't get to work. And I think that's the realities that some people struggle with when it comes to finances, Sean.
Yeah, well, I think it's just shows you how financial pressure snowballs, into fear, absenteeism, and Danny, to your point, into safety risks. So how do businesses help their employees address this? Is there a solution?
There is, Sean. I think addressing the kind of solution and addressing financial stress starts with understanding the realities. Sorry, they're sort of drilling around me here. Providing practical and accessible support as well. Kaelo Lifestyle included a solution through the integration of Kaelo Money, which is a responsible money management solution, which provides employees or members with means to cater for those unexpected expenses, and then tools to improve their financial well-being, and then rewarding them to do so as well. The thinking behind the integration was born out of the fact, as I mentioned, that 68% of all our stress-related counselling cases could be tied back to a financial stress of sorts. And just like the example Celeste gave now, that financial stressor can often be crippling and misinterpreted within a business. So what we did is we actually sent out a survey to the just over 1 million people on the Kaelo Lifestyle base. And some of the results came out showing us quite scary stats. One of them being that 87% of all the respondents didn't know the interest rates that they were paying in their debt accounts, which in itself speaks to the low financial literacy rate. Even more concerning was that 37% of people have already used a loan shark. So our challenge in this whole scenario is quite clear. We need to come up with a solution that tackles the leading cause of our mental instability or stress within our population, and do so with a population that also doesn't understand or grasp the importance of doing so as well. Kaelo solves through this with the integration of the two products. And we've seen a significant decrease in the number of stress-related counselling cases, and an even more significant increase in the number of financial coaching cases, leading to an overall increase of 800% on the Kaelo Lifestyle utilization when Kaelo Money is introduced as well. This is wholly owed to a couple of elements within Kaelo Money that drive that financial wellness. So, for example, the request to call back after every engagement, the ease of use to all the financial content and articles and courses and related content, The built-in reward system also drives that increase in financial utilization and that financial literacy. People are now being rewarded to stay financially literate. Things like our pattern identifier make sure people can't abuse the platform and in fact are driven again to the financial literacy elements. People who are identified with formal judgments on their name or what's informally known as being blacklisted are then driven into our financial support elements as opposed to giving any sort of funding. So all of these sort of solve for that.
Thanks, Danny. Thank you for those examples. And it's just one way that we can address it from a business perspective or help businesses address it, because I think ultimately employees are going to lend money one way or the other. It's just how we address it in a safe and with the outcome of actually trying to create financial wellness. So we've spoken about mental health, we've spoken about stress, both at home, that comes into the work environment. People are under a lot of pressure. So it brings us to our next question. With the evolution of an EAP, what makes an EAP truly relevant in today's world of work? Celeste?
So Sean, I think EAPs are more relevant than ever today. We know that the scale of mental health challenges is bigger and more visible. We've spoken about how since COVID, stress and burnout and anxiety and depression and, like Danny highlighted, financial strain have just spiked. And I think thanks to COVID, more people are willing to ask for help because it has, despite the fact that we still see stigma, there's a willingness to say, I'm struggling, I need help. And I saw an interesting article the other day that speaks to state facilities and the limited mental health resources that's available. So if we just look at psychiatric care, there's about one psychiatrist for every 100,000 people. So EAPs bridges the gap for people to access relevant, professional, confidential support. Things like hybrid work, digital overload, and economic uncertainty means that our employees are juggling blurred boundaries and financial stress. And a robust EAP addresses that with practical help. You've heard examples of the Kaelo lifestyle program and what we do. And just to highlight that with counseling and coaching support, financial coaching, try to provide the practical guidance that can really make a purposeful difference for people in their lives. We also know that for some employers, an EAP is sometimes a tick box exercise. But where there is a robust EAP and people genuinely engage, it shows a genuine care for the employees, that the employer cares for the employees. It creates a culture of psychological safety and it lowers stigma and just helps people. We've spoken about it and Danny mentioned how unaddressed mental health or personal crises can cost companies through absenteeism and presenteeism, errors and turnover of staff. And EAPs really help to reduce these costs by providing early intervention and professional guidance. A recent research study that looked at absenteeism specifically found that in companies where there is a robust EAP, it took down the absenteeism days on average of 13 days to 6 days. That's nearly taking it down to half the number of absenteeism days. At Kaelo, we believe that in a world where life's challenges are more visible, complex and costly to ignore, an EAP is no longer just a nice to have. It's a strategic must have. It protects your people and your business.
I agree with you, Celeste, completely. But, you know, it's interesting, even with that understanding, some businesses are still hesitant to introduce an EAP, or they're on the fence as to whether or not they should do it now or next year. I mean, are there any stats to support those risks from a business perspective, Danny, of not implementing an EAP today?
Yeah, Sean, I mean, we've spoken about the cost of absenteeism. We've spoken about the cost of presenteeism, the quiet quitting, the risk of productivity, safety, the overall success of an organization. These costs are staggering risks for a business to uptake if they don't want to introduce a solution like an EAP. From a member's perspective, both for themselves and their family, access to an EAP makes vast differences in their lives. They feel supported, they feel they're being employed by an employer of choice who cares about them. So definitely, it's quantifiable, the cost of it. I know Celeste has got some further on that.
Yeah, so I think ultimately it is, as a business, it's going to cost you. If you have an EAP, you pay the cost of the EAP and your staff is protected and supported. But if you don't have it, there's the cost that Danny alluded to earlier on. I think just a couple of points here in terms of those mental health issues that goes unaddressed, and it's often unaddressed until it's too late, right? So employees struggling with the stress and the anxiety and family crises without an EAP have nowhere to turn for confidential and professional help. They often stay silent and withdraw until they reach breaking point. And that leads to the absenteeism stats, the presenteeism, and higher rates of disability that Jordan also spoke about earlier on. Often where there's no EAP in place, managers carry the hidden burdens. Without an EAP, managers and HR people often become your unofficial counselors for complex personal issues that they're not trained to handle. This creates emotional risk for managers, inconsistency in support, and often poor outcomes for the employee. Unresolved mental health and personal problems we know show up in poor performance, low morale, errors, conflict, and high staff turnover. Productivity losses and replacement costs far exceed what an EAP would cost. For example, untreated depression alone is linked to 30 plus lost workdays per employee per year. Without an EAP, people carry those burdens alone, and the organization absorbs the hidden costs in productivity, morale, retention, and risk. Bottom line, you either pay for support proactively or you pay for the consequences reactively.
Very true, Celeste. The question shouldn't be, should we do this, but rather, can we afford not to do this?
Yes.
So I asked you to pop some questions in the bottom of the question box if everybody has. From what I can see, there are no questions. And this brings us to a close of our webinar today. So thank you everyone for joining us. At Kaelo, we believe that when people are supported as whole human beings, not just as employees, they show up stronger, more focused, and more connected. And that's the kind of workplace we're committed to helping our clients build. Thank you so much for joining us today. And if you need any more information, please reach out to your BDC. Thank you very much. Goodbye.
Bye, everybody.
Goodbye.
Bye.
Bye.